did you know that aminoglycosides are among the few antibiotics that can kill bacteria rather than just inhibit them? In this lecture, let's explore the therapeutic uses and clinical significance of this group of antibiotics. So before discussing the therapeutic uses, it is important to know key pharmacokinetic features that influence the use of this group of antibiotics. So one of the key pharmacokinetic features of aminoglycoside is that they are highly polar and basic drugs. Because they are highly polar, they are less lipid soluble, there is decreased permeability across the membrane, and this causes poor oral bioavailability. So the oral bioavailability decreases, there is decreased absorption through the intestinal tract, and therefore aminoglycosides are given via intravenous and intramuscular route. Parenteral route of administration is preferred for aminoglycosides because of poor oral bioavailability. In terms of excretion, 90 to 95% of the intravenous dose is excreted through the kidney by glomerular filtration. Because they attain high concentration, high urinary concentration, they are useful for the management of urinary tract infections. Also, do keep in mind that these drugs are active in alkaline pH rather than acidic pH. So, the use of alkalizer in urinary tract infections increases the effectiveness of aminoglycosides. In terms of excretion, 90 to 95% of the intravenous dose is excreted by glomerular filtration through the kidney. Because they attain high concentration, high urinary concentration, they are useful for the treatment of urinary tract infections. Do keep in mind that aminoglycosides are active at alkaline pH rather than acidic pH. So the use of alkalizer in urinary tract infection increases the effectiveness of aminoglycosides in the management of urinary tract infections. So this is an advantage of aminoglycosides because of its excretion through the kidney. But the downside is that in case of renal insufficiency, in kidney failure, aminoglycosides should be avoided. Dose modification is needed because there can be accumulation leading to toxicity. So in renal insufficiency, dose reduction is needed because they are excreted through the kidney. They are completely dependent on the kidney for excretion, leading to toxicity in renal insufficiency. The next feature of aminoglycoside is post-antibiotic effect and concentration-dependent killing. So what is post-antibiotic effect? Aminoglycosides have a short half-life of 1 to 3 hours. And generally, drugs that have a short half-life need to be administered more frequently. But aminoglycosides, despite of having a short half-life, is administered as a single daily dose, and a single dose is adequate to maintain therapeutic effect. This is because of post-antibiotic effect, which means that the drug aminoglycoside antibiotic continues to suppress bacterial growth even after the serum concentration falls below the minimum inhibitory concentration. So the serum concentration, even if it falls below the minimum inhibitory concentration, the bactericidal effect continues for few hours after discontinuation of the dose. Aminoglycosides also exhibit concentration-dependent killing, which means that a single large dose is preferred over divided doses, that is, doses administered 8 to 12 hourly. This is because at higher concentration, there is greater bactericidal effect. When the tissue concentration is increased, there is a higher proportion of bacteria that is killed at a rapid rate than in divided doses. So higher concentration produces enhanced bactericidal effect than when administered in divided doses. Now let's move on to the antibacterial spectrum to know the therapeutic uses of aminoglycosides. They are highly active against gram-negative bacilli such as E. coli, Klebsiella, Proteus, Pseudomonas. Salmonella is however excluded. They are not effective against gram-positive bacilli. So gram-positive bacilli is not affected by aminoglycosides. Aminoglycosides treat serious gram-negative infections. When aminoglycosides are combined with beta-lactam antibiotics such as penicillin, vancomycin, its coverage against gram-positive cocci such as Streptococcus, Staphylococcus increases. So coverage against gram-positive cocci such as Streptococcus, Staphylococcus increases when aminoglycosides are combined with penicillin or vancomycin. Because they are cell wall synthesis inhibitor, they enhance penetration into the cell, enhances the bactericidal activity and increases the coverage against gram-positive cocci. However, gram-negative cocci is not affected by aminoglycosides. So, gram-positive bacilli and gram-negative cocci are not affected by aminoglycosides. Now coming to the individual drugs and the therapeutic uses. The drugs that are included under aminoglycoside category are streptomycin, gentamicin, tobramycin, amikacin, neomycin and paromomycin. Streptomycin use is reduced. It is rarely used nowadays because resistance to streptomycin develops very rapidly. So streptomycin is usually used in combination with other antibiotics. It has few indications where they are used as a single agent. So indications where streptomycin is used as a single agent are tularemia, plague and brucellosis. So these are the few indications where streptomycin is used as a single agent. They can be used in combination with tetracycline or it can be combined with penicillin in the treatment of subacute bacterial endocarditis where the causative organism is Streptococcus viridans, which is a gram-positive cocci. So increase the coverage, aminoglycoside is combined with penicillin. It can also be combined with anti-tubercular drugs for the management of tuberculosis. So streptomycin is used in the management of tuberculosis in combination with other anti-tubercular drugs. So streptomycin is used in combination with other anti-tubercular drugs for the management of tuberculosis because resistance to streptomycin develops very rapidly. The most commonly used aminoglycoside is gentamicin. It is used for treating serious gram-negative infections such as septicemia, pneumonia, particularly hospital-acquired pneumonia which is caused by resistant organisms such as Pseudomonas, Proteus, Klebsiella, the causative organisms. It is not effective for treating community-acquired pneumonia where Streptococcus or Pneumococcus is the causative organism. So, hospital-acquired pneumonia, nosocomial pneumonia can be treated by gentamicin. Complicated urinary tract infections where the causative organism is Proteus, Pseudomonas is treated by gentamicin. The next use is subacute bacterial endocarditis where they are used in combination with penicillin or with other beta-lactam antibiotic to enhance the coverage against gram-positive cocci. Tuberculosis we have already discussed. They are used for treating tuberculosis in combination with other anti-tubercular drugs. Speaking about tobramycin, the profile is similar to that of gentamicin and it can be used for treating infections that are resistant to gentamicin. The next drug is amikacin. Amikacin is resistant to the enzymes that inactivate gentamicin and tobramycin. So infections that are resistant to gentamicin and tobramycin can be treated with amikacin. Amikacin is also highly effective against multi-drug resistant tuberculosis. Next is neomycin. To be noted that neomycin is highly nephrotoxic and it has high cochleotoxic potential. Because of its high toxicity when administered systemically, they are administered topically. Now the topical preparations of neomycin are available. They can be combined with bacitracin to increase the gram-positive coverage and they can be combined with polymyxin B to increase its coverage against Pseudomonas. Now neomycin and erythromycin can be combined together and administered orally and it acts as a pre-operative intestinal antiseptic given a day prior to surgery. So it is used as an intestinal antiseptic when given orally combined with erythromycin. Neomycin is also useful in hepatic coma And the pharmacological basis for this is that neomycin kills or it destroys the coliform bacterial flora that produces ammonia. So it suppresses ammonia production by destroying the bacteria that produces ammonia. So by reducing the ammonia formation, it is useful in the management of hepatic coma. Lastly, paromomycin can be used for treating GI tract infections such as intestinal amoebiasis, causing amoebic dysentery, abdominal cramps, the patient presents with watery stool. It can also be used for treating cryptosporidiosis, which is caused by cryptosporidium, which is an intestinal protozoa, and it resides in the intestinal tract and it manifests as watery diarrhea, abdominal cramps. So paromomycin used for treating GI tract infections. Paromomycin useful for treating GI tract infections such as intestinal amoebiasis and cryptosporidiosis. So we have discussed the important pharmacokinetic features and the therapeutic uses of aminoglycosides. If you find this video useful, please like, share and subscribe to this channel. Thank you for watching.